We are among the few transplant centers in the province of Sindh who are working very hard and providing the standard of care and best quality of services in the field of live related kidney transplantation. And we have unmatched quality of services which we are providing to our patients. 24/7 services are provided in our hospital, and every facility is available under one roof. That is the state of art transplant center which we can compare with any transplant center in the world.
The number of patients with renal failure are increasing day by day. Therefore, a significant population of patients requires hemodialysis daily in our country. The major contributing factors toward this are uncontrolled diabetes, uncontrolled hypertension, renal stones, self-medication, and above all, ignorance towards their disease. The low literacy rate in our country contributes and plays a vital role in further worsening the situation. And for the same reasons, our patients stay in denial and use non-recommended methods of treatment in the hands of quacks.
Kidney failure doesn't only affect the patient himself, but there is a chain of effects including his family, friends, and social circle.
We are receiving numerous patients awaiting transplant, those suffering from kidney diseases and are in debilitating condition due to suboptimal dialysis facilities, high cost of treatment, associated mortality risks, socioeconomic instability, and facing social stigmas.
We are facilitating every patient requiring transplant, helping through every step ranging from legal requirements, in-house services to post-transplant coordination between patient and doctors.
Kidney transplant is not just a surgery, it is an integrated process which gives a new healthy life to the recipient. We conduct an extensive and a careful workup of after selecting a suitable recipient and its donor, and this extensive pre-transplant workup play a major role in the successful kidney transplantation.
The success of a transplant surgery is the result of the efforts of a dynamic duo who work in complete cohesion and with utmost dedication, the surgeons and the anesthesiologist. They pair up for this marvelous surgical adventure, and here at Dow University of Health Sciences, I am lucky to be heading one of the most finest, well-experienced and most thorough professionals. And with this anesthesia team, I am proud to say that we give one of the best results which can be comparable to any national as well as international setup of the world. The smile on our patient's face are the result of the endless efforts put up by the whole anesthesia unit, and this does not just include the doctors, it also includes our paramedical staff, our technicians, our technologists, and the help of such equipments which make us possible for a surgery, especially a transplant surgery, to be successful.
In order to get a successful transplant, it's not an easy job. We have to investigate very thoroughly from every aspect. We have to take care of the donor as well as the recipient. We investigate very thoroughly. We involve every department like cardiology, pulmonology, anesthesiology. If we required any further assistance from gastroenterology, so all these departments are on board, especially the immunology department, who are working very hard in collaboration with us, because you are dealing with two lives and every life matters. So you have to be very careful in order to proceed for any transplant surgery.
We observe the ray of hope in the face of patients routinely going for renal transplant at our facility. Nothing matches the magnitude of pleasure we attain when we see them going through transplant successfully, and this feeling gets amplified when they return home few days after the procedure, leaving behind the memories of renal failure.
जब से मेरे गुर्दे फेल हो गए थे तो मैं डायलिसिस करवा रहा था, वो मेरे ज़िंदगी के मुश्किल तरीन दिन थे। अब जब से मैंने अपना ट्रांसप्लांट करवाया है तो अल्हम्दुलिल्लाह मेरी सेहत भी बेहतर है और मेरी तकलीफ़ें मुश्किलातें भी दूर हो गई हैं। अल्हम्दुलिल्लाह अब कोई भी मुझे देख के पहचान भी नहीं सकता कि मैं पहले वाला ही बंदा हूँ।
In Dow University Hospital, we have a full-fledged kidney transplant unit, which have dedicated two transplant theater, which are fully equipped with the state-of-the-art equipment, and we have a dedicated transplant ICU. We have private ward in which we admit the patient for pre-transplant workup, and then we have two ward for the post-transplant treatment of the patient. And above all, we have a very dedicated and trained medical staff who care our transplant patient 24/7.
We are not only a clinical setup, but we are trying our best to emerge as an academic institution as well. We conduct clinical rounds, briefing for fellow surgeons during surgeries, and engage our colleagues in different activities to boost their knowledge in order to provide a seamless educational environment.
Now, by the grace of God and Almighty Allah, Alhamdulillah, we have achieved a milestone which is 500 live related renal transplant, successful renal transplant. So it's not an easy job. It always needs a teamwork, which includes doctors, which includes nurses, which includes your transplant coordinators, which includes your transplant technologists. Everyone has a very important and pivotal role in order to go through a successful transplant. So I appreciate my team and above all the faculty which is involved and working very hard to get this milestone. We stand committed
for the best of our patients.
Because together we can make a difference.